family back.
To learn more, visit hfotusa.org.
Indiana in the Morning, presented by First Commonwealth Bank, here on WCCS 101.1 FM, AM 1160, WCCSradio.com, and our interview segment presented by Marcus & Mack, voted Best Personal Injury Law Firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. We continue our acknowledgement and commemoration of Mental Health Awareness Month. And joining us in studio once again, as he has every Wednesday this month, Dr. Ralph May. Dr. May, it's good to see you again, sir.
Thanks for having me, Josh. Good to see you, too.
Now, we were talking last week whenever we were planning things out and trying to think of some ideas. So one of the things that I wanted to touch on when it came to mental health awareness, I mean, you had talked about it in adults. You had talked about it in college students, so the young adult set. But now let's talk about it from a child's perspective. I mean, we don't necessarily think of child mental health as part of a child's upbringing unless it is instances like bullying or things like that. But even children, they can go through a lot of things with problems with their mental health.
Yeah, actually, we're getting better at recognizing difficulties that children may be having with their mental health. We know that in the United States, about 1 in 5 children over the course of their development will experience some type of mental health disorder. The most common occurring in childhood is anxiety. Now, anxiety is not just being a little nervous, about things, but a persistent worry, a persistent fear that becomes disabling. The child can't function in school, or the child has difficulty sustaining friendships, or has difficulty wanting to do things. ADHD, attention deficit hyperactivity disorder, particularly in males, emerges at about age 4 and 5 years of age. It shows up early, particularly for males, a little later for females, but it can be very disruptive to learning. Can't focus, can't sit still, can't pay attention, and that hits right when you're starting school.
Yeah,
and so right when you need to be able to focus and learn, that can become very disabling for young kids in particular, because once you have trouble learning and you can't fix it by just sitting down and sitting still, learning becomes aversive. It becomes a negative experience. So they start not liking to go to school, start having trouble in school. So recognizing ADHD, recognizing anxiety at a young age is very, very important, because these can affect the child's willingness to learn. And we know that in our society, our culture in particular, academic learning, being able to learn, is a very important skill you need. And that gets started very, very early in development.
I remember back in the day, back in my when I was going through school, and kids had ADD or ADHD, they had Ritalin as a treatment, but we now know that is, how do I put it, not the best treatment in the world right now.
Well, medication and behavioral interventions for ADHD is the best combination. Recognizing that you need to change schedules and work with structure a little bit to help these kids learn, develop some special learning tools to help them. But medication for ADHD is very effective. Now, many parents are reluctant, but I've seen it work very well. Being a psychologist, I'm not a prescriber in the state of Pennsylvania, but working with psychiatry, I've seen parents come in and say, oh, my God, it's a completely different kid. He was climbing the walls, he couldn't sit still, and now he's much better. So we have to remember that medication plays an important role in the work with ADHD. Now, in anxiety, it's a little different. Depression, it's a little different.
Yeah.
Medications don't work quite as well in childhood for anxiety and depression as they do for adults.
It's probably because the kids' brains are not as developed.
Brain is still developing, and so it doesn't quite work as well. So therapy, cognitive therapy and behavioral therapy and family therapy are very effective at helping with those conditions. Again, it's a case of recognizing the difference between normal anxiety, just being a little worked up about something, that you can push through, and the anxiety that is really disabling, that keeps the child from being able to function.
Yeah, I mean, there are lots of cases out there probably of a child just shutting down in certain situations because they have that anxiety going forward. It's not like it's stage fright or anything that. No, that's common.
Right.
But you mentioned anxiety. You mentioned ADHD. What are some other things that have been popping up on the radar?
Depression. We're recognizing that children can develop depression at a young age. They typically look like they're withdrawing, they're isolating, they're not interacting as much. Children sometimes get tearful, but not like adults. They tend to show it behaviorally. They tend to show it as a withdrawal, an avoidance, isolating to themselves, not wanting to do things that used to be fun. just avoiding having normal kind of interactions. And that kind of withdrawal is very debilitating because it isolates you from your family, your friends, your peers, academic work.
Yeah.
And so it's important to recognize children can develop depression as well. It's not as common as anxiety and ADHD, but also we need to remember that depression biochemically and from a hereditary perspective, it does run in families. So if you know that as a parent, you've struggled with depression, or aunts and uncles, grandparents have, the child may be vulnerable to that, just like you can be vulnerable to heart disease, you can be vulnerable to diabetes, you can be vulnerable to other kinds of things. You've got to pay attention to the fact that your child may have certain risk factors, and you need to pay attention to the warning signs there.
And if left unchecked, this could develop into problems further down the road.
Right. And of course, being on the Suicide Task Force and that being my area for a number of years, the second leading cause of death in adolescence in the United States is suicide. Accidents are first, suicide is second. And we need to recognize that depression and isolation, loneliness, and this is important, Josh, that, we think the internet, Facebook, all the social media platforms we have, the kids are really connected.
Yeah.
Well, they're connected and not connected.
Yeah, there is a difference between the online connection and an in-person connection.
Exactly. And that you can be lonely, powerfully and painfully lonely, and have 1,000 friends, right?
Yeah.
But that doesn't mean you have real friends. And you don't have that connection. And loneliness, the Surgeon General has said, and we think about just adults being lonely, kids can feel very lonely and isolated, even in a large group of people. And so we have to remember that isolation, that loneliness can be very toxic.
All right. We're talking with Dr. Ralph May, wrapping up Mental Health Awareness Month by talking about some issues for children mental health. Dr. May, one of the things that you had mentioned, obviously, is treatment for these kids, for children. And obviously that's going to be very different than what an adult might go through when that comes around. And we know that there are specialists in this field, right?
There really are. And we have quite a few of them in Indiana. Actually, we have a lot of child therapists and we've actually been blessed. We have a couple of really good child psychiatrists in Indiana.
Excellent.
And so the most important thing is if you're a parent, you're a caretaker of a child, you have a gut feeling sometimes they're not okay.
Yeah, that sixth sense goes off.
Not okay. Something's not right. And so it doesn't cost anything to contact a therapist, to contact, we got our crisis line, we got our mental health line here in Indiana. Call and ask questions. Say, could this be a problem? Get a first appointment and evaluation. And your pediatrician is really a resource too. You can talk to your pediatrician about what's going on with your child, have them do a good physical to make sure there's not some kind of physical issue that could be causing this.
Right.
Sometimes anxiety can be thyroid problems. So you have to make sure you have a good physical from the pediatrician and then get a referral for a therapist. There are lots of good therapists in Indiana County. Of course, I'm going to plug for my old agency, the Guidance Center, but we've got neuropsych, we've got, plenty of private counseling and public counseling agencies in Indiana. The problem isn't that we have counseling agencies available, it's that people don't use them, and whether you're an adult or thinking of services for your child, it's important to get over that hump. The brain is an organ of the body. I keep saying that. You need to treat yourself just like any other thing. Get a checkup.
It's that stigma, I think, and I think for a child as well, especially if they are an older child into the teen years. If it gets out that I'm going in for mental health sessions, I'm not going to be. It's not that I'm going to be picked on. Right. I'm going to be egged about. But really, it is worth it. It is worth it.
And I'm going to tell you, Josh, I've been in the business now for over 40 years. It was a lot worse 40 years ago. Now at least the stigma has lessened. It's still there. But, I think it's a lot less. More celebrities are willing to talk about this. More people are willing to come forward. And I think it's really good to just normalize it. I know, one of the things that always made me happy is I would run into one of my patients at Walmart or whatever, and they'd say, Dr. May, how you doing? And say, you really want to keep your confidentiality? I say, I don't care. I see you for depression. You're helping me. That really made me feel good. It's like, treat it like any other thing, and it's like, it's no big deal. This is depression. I'm getting help for it. That's the way it goes.
Anything that can be discussed, it makes it automatically becomes easier. Something along those lines.
Right.
That a quote from Fred Rogers that just popped into my mind. Anything that's discussable is manageable.
That's exactly right. Don't be afraid to open it up and talk about it. There's plenty of help around, and don't be afraid to reach out for it.
And how can people reach out if they feel they need it?
The central place in Indiana, we worked long and hard to get this going, is our mental health crisis line. It's not just for crisis, but if you have questions, the number is 877-333-2470. It's a toll-free number, and you use that number. It's 24/7. There's a therapist on that line, 24/7, 365 days a year. You call and you ask questions. Like, it doesn't have to wait. I would rather it not wait until it's an emergency.
Right, yeah.
It's like anything. Why wait until you're having the heart attack? You're having the chest pain, call and get taken a look at.
You're seeing those initial signs. You're getting
Right.
that sixth sense that we talked about.
That's right.
That's the time you should call. Don't let it wait until it gets worse and worse and worse until the point that it becomes very difficult.
That's right.
To treat. Dr. May, this has been very enlightening, and I hope a lot of our parents who are listeners and watching this on our Facebook page, I hope they get to take this to heart, because, as we said, it's kind of whenever we talked about it, it almost came up as an afterthought.
Right. We don't think about kids as much as we think of adults, but we know one thing: the earlier the problems show up, the more important it is to get to them early.
Mm-hmm. Definitely. Dr. May, thank you very much for all the interviews this month. This has been very enlightening.
Thank you, Josh, and thanks for having me.
All right. Dr. Ralph May joining us here on Indiana in the Morning. Our interviews presented by Marcus & Mack, voted Best Personal Injury Law Firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. And if you missed any of Dr. May's interviews this month, we have them archived on our Facebook page. We also will have them archived on our website, wccsradio.com. Check it out. It's on the Indiana in the Morning page, and you'll be able to find those interviews there once they are posted. But again, Facebook page is another place where you can go to take a look at those archived interviews. We're getting close to 8:24 in the morning here on Indiana in the Morning. So coming up next, Boomer in the Sports Minute, a check of local news headlines coming up at the bottom of the hour, and a full check of sports with Jake Slobodnik. And we'll also have Bill Geiger with Rotary Club. The AMBA blood testing program's getting underway soon. That's coming up next here on Indiana in the Morning.
This is Boomer Esiason with a Sports Minute, sponsored by Napa Silent Guard Brakes. Today's birthday shout-out goes to Paul Skeens. Oh, to be 22 years old with a 100-mile-an-hour fastball and a gymnast model Olivia Dunn playing Taylor Swift to your Travis Kelce. What personally impresses me about the Pirates' rookie right-hander is his long-term commitment to the Gary Sinise Foundation, which supports veterans and first responders and, of course, their families. Way to go, Paul. Happy birthday. I'm Boomer Esiason.